Welcome to our YouTube channel, Vikaran Drishti. Today we are here with another new multiple choice question video based on Skull Radiography Part 1. This video is going to be very useful for those who want to understand the basic concepts of skull radiography and are preparing for competitive exams. Question number 1. Which of the following traditional special Roentgen views are no longer commonly used for imaging facial bones due to the comprehensive information provided by HRCT? Option A is Mayer. Option B is Schuller. Option C is Stenvers. Option D is all of the above. The correct answer of this question is option D. All of the above. Question number 2. Which of the following have high radiographic contrast than water? Option A is vascular clips. Option B is bioimplants. Option C is fragments of projectiles. Option D is all of the above. The correct answer of this question is option D. All of the above. Question number 3. Today the main purpose of plain skull films is option A is to detect abnormalities in the cranial bones. Option B is to detect abnormalities in ventricles. Option C is to detect abnormalities in occipital lobe. Option D is none. The correct answer of this question is option A. To detect abnormalities in the cranial bones. Question number 4. Axial radiographic views of the skull base are now considered obsolete because of option A is HRCT. Option B is low-dose CT. Option C is complex procedure. Option D is CCT. The correct answer of this question is option A. HRCT. Question number 5. The semiaxial Tone view is an option A is AP projection. Option B is PA projection. Option C is lateral projection. Option D is superinferior projection. The correct answer of this question is option A. AP projection. Question number 6. The lateral skull films demonstrate the cranial vault along with most of the facial bones and option A is C1. Option B is C2. Option C is C1 and C2. Option D is C1, C2 and C3. The correct answer of this question is option C. C1 and C2. Question number 7. In lateral position tube angulations is option A is 5 degree towards head. Option B is 5 degree towards leg. Option C is 15 degree towards head. Option D is no tube angulations. The correct answer of this question is option A. 5 degree towards head. Question number 8. Which imaging modality is still considered the best for evaluating the texture of the calvaria, while CT is superior for detecting depressed fractures? Option A is MRI. Option B is ultrasound. Option C is plain films. Option D is HRCT. The correct answer of this question is option C, plain films. Question number 9. Which of the following views is best for evaluating the occipital bone? Option A is Caldwell view. Option B is Toney's view. Option C is Waters view. Option D is submentovertex SMV view. The correct answer of this question is option B, Toney's view. Question number 10. Which radiographic view is most suitable for detecting orbital fractures? Option A is Parr-Caldwell view. Option B is Waters view. Option C is lateral skull view. Option D is Toney's view. The correct answer of this question is option B, Waters view. Question number 11. The Schuller's and Stenver's views are traditionally used for imaging which skull structure? Option A is mandible. Option B is frontal sinus. Option C is temporal bone. Option D is occipital bone. The correct answer of this question is option C, temporal bone. Question number 12. Which of the following skull radiographic views is primarily used to visualize the sella turcica? Option A is lateral skull view. Option B is Caldwell view. Option C is Toney's view. Option D is submentovertex SMV view. The correct answer of this question is option A, lateral skull view. Question number 13. Which skull fracture is most commonly associated with air fluid levels in the sphenoid sinus? Option A is linear skull fracture. Option B is basilar skull fracture. Option C is depressed skull fracture. Option D is diastatic fracture. The correct answer of this question is option B, basilar skull fracture. Question number 14. A ping-pong fracture is most commonly seen in which group of patients? Option A is elderly individuals. Option B is adolescents. Option C is newborns and infants. Option D is adults with osteoporosis. The correct answer of this question is option C, newborns and infants. Question number 15. Which anatomical landmark corresponds with the level of the petrous ridges in skull radiography? Option A is nation. Option B is glabella. Option C is top of the ear attachment, T. Option D is acanthion. The correct answer of this question is option C. Top of the ear attachment, D. Question number 16. Which skull positioning line is aligned perpendicular to the image receptor in a true lateral skull projection? Option A is orbitomeatal line, OML. Option B is infraorbitomeatal line, IOML. Option C is glabellomeatal line. Option D is interpupillary line. The correct answer of this question is option D. Interpupillary line.